You can change this, I tell the men who sit in my clinic with the slow resignation of someone who has been told for years that age is destiny. 3 small habits you do every day can ease the pressure, reduce the urgency, and give you back nights without constant trips to the bathroom. I'm Dr. Michael Reyes, a board-certified urologist with more than 15 years seeing men navigate this exact problem, and I want to be direct. These are practical steps, not magic cures, but they matter. If this sounds relevant, take a moment to like this video and stay with me through the next 10 minutes. What I explain now can be started tonight. Think of the prostate like a sponge seated below the bladder. When the sponge swells with inflammation, or when the bladder above it becomes heavy and overfilled, that sponge is squeezed. Imagine a brick pressing on a soft sponge. The pathway for urine narrows and symptoms follow: slow stream, urgency, getting up at night. There are 3 daily things you can do to change the pressure dynamics in that small space. Move to improve circulation, manage evening fluid and alcohol to limit bladder overload, and choose foods that calm inflammation. Each habit affects a different part of the problem: circulation, bladder behavior, and prostate irritation, and together they reduce the load on that sponge. Let me start with a basic map of what's happening. The bladder sits like a water balloon above the prostate. If you hold urine for long periods, through meetings or long drives, the balloon stays distended and presses down. That constant pressure makes the prostate more reactive, like a sponge repeatedly squeezed. Inflammation in the prostate itself is fed by poor pelvic circulation and by certain dietary patterns and alcohol use. Research shows that modest changes in activity and diet lower measures of inflammation and improve urinary symptoms over weeks to months. None of this replaces specialist care or medication when needed, but it gives you control you probably didn't know you had. The third habit I want you to adopt is the daily circulation boost, a 30-minute walk or equivalent movement to pump blood through the pelvis. Mechanically, walking acts like a river through a delta. Each step pushes fresh, oxygen-rich blood into the pelvic tissues and sweeps away inflammatory byproducts. Studies have linked regular, moderate exercise to fewer lower urinary tract symptoms and better bladder control. The protocol I recommend is deliberately simple, so you'll do it. Start tonight with a 10-minute walk after dinner and aim for a brisk 30 minutes most days of the week. If 30 minutes is too much at first, break it into 2 15-minute walks. The immediate action you can take tonight is to stand up after dinner and walk the block, feeling your pulse rise gently and the shoulders loosen. I had a patient from Seattle, a retired teacher, who came in because he was waking 3 to 4 times a night and felt anxious about long car trips. He'd been largely sedentary since retirement. We agreed on a program of daily walking, building up to 30 minutes over 3 weeks. At his 6-week follow-up, he reported fewer nightly trips, down to 1 or none most nights, and felt less urgency during the day. He wasn't cured. We adjusted other parts of his routine too, but the circulation change made a visible difference in about 4 to 8 weeks. Expect to notice small improvements in energy and reduced nighttime frequency within a few weeks, with clearer benefit in 2 months if you stay consistent. Habit number 2 is an evening bladder strategy that reduces mechanical pressure. Time your fluids, limit alcohol, and adopt a 5-minute bathroom rule. The bladder behaves like a brick sitting on the prostate when it's overfilled. The heavier it is, the more it compresses the gland beneath. Alcohol amplifies both urine production and bladder irritation, and late-night drinking is a common driver of nocturia. Research shows that reducing evening alcohol and managing fluid intake before bed lowers nighttime voids. The practical protocol is threefold. First, taper liquids 2 hours before bedtime. No water, tea, or other drinks in that window. Second, limit alcohol to no more than 2 to 3 standard drinks per week if possible, and avoid drinking within 3 hours of sleeping. Third, when you feel urgency during the day, use a 5-minute rule. Pause for 5 minutes, do a short pelvic contraction, like a gentle Kegel for 2 seconds, and then attempt to void, which retrains bladder sensation and reduces the habit of immediate running to the bathroom. A man from Boston I saw had the habit of having 2 beers with dinner and a glass of water before bed. His sleep was broken twice nightly. He reduced alcohol to social levels and implemented the 2-hour fluid taper plus the 5-minute pause. Within 6 weeks, he reported 1 fewer interruption and said he felt less anxious about leaving the house. That expectation, noticeable changes in nights within 4 to 8 weeks, appears in multiple clinic experiences. The immediate step you can take tonight is to skip water an hour before bed and resist the late-night drink. Try the 5-minute pause the next time you feel a sudden need. Now we get to habit number 1, the daily anti-inflammatory food habit that often surprises men with how much it helps. Incorporate a daily portion of cooked tomatoes or food rich in lycopene, and pair this with a modest reduction in overall portion size to influence weight. Think of inflammation as tiny lights burning in the sponge. Certain foods oil the gears and others pour water on those flames. Lycopene, the pigment concentrated in cooked tomatoes and tomato-based sauces, is consistently associated with prostate health markers in observational studies and appears to reduce inflammatory activity. Additionally, excess weight increases abdominal pressure and can worsen bladder and prostate symptoms. A modest, sustained weight reduction of around 10 to 15%, or even a consistent 20% smaller dinner portion, changes the pressure dynamics. The protocol I give men is practical. Include a half cup of cooked tomato sauce or a medium baked tomato in your main meal each day, or a serving of tomato-based soup, and aim to make that meal slightly lighter, reducing portion sizes by about 15 to 20% compared to what you usually eat. Don't chase specific pills. Make tomatoes part of a balanced plate, vegetables, lean protein, and whole grains, and watch for a modest weight decrease if you pair this with the walking habit. In terms of what to expect, research and clinical experience show that dietary shifts like this can change symptoms over 2 to 3 months as inflammation quiets and pressure lessens. A retired engineer from Melbourne who loved his nightly pasta swapped one of his 3 weekly red meat dinners for a tomato and vegetable stew 5 nights a week. He also reduced his plate sizes slightly and reported a calmer bladder within 8 weeks, with less urgency and improved stream. He did not stop his prescribed medication until he and his doctor discussed adjustments. This is important. We never advise stopping medication without clinical guidance. The immediate action you can take tonight is to prepare or heat a small portion of cooked tomato sauce and add it to your dinner, and consciously make your plate about 1/5 smaller. As you put these 3 habits into practice, walk to improve pelvic circulation, manage evening fluids and alcohol to reduce bladder load, and add cooked tomatoes while trimming portions to lower inflammation and abdominal pressure, you address the mechanical and inflammatory drivers that make the prostate feel worse with age. They work on different levers. Movement clears and nourishes the tissues. Fluid and alcohol control keep the bladder from constantly compressing the prostate. Diet nudges the inflammatory tone. Together, they often yield better symptom control than any single change. I want to be clear about expectations. Improvements are rarely instantaneous, but you will often notice small wins quickly. Less anxiety about leaving the house after a week or 2 of the 5-minute pause, better sleep after cutting late drinks for several nights, and the first signs of reduced daytime urgency after several weeks of combined habits. Meaningful reductions in symptom burden typically appear in a month to 3 months, depending on how consistent you are and whether other medical factors are present. There are common tensions men bring into the clinic. One is the thought, "This is just getting old, nothing will help." That resignation is understandable, but it isn't a final verdict. Another is embarrassment, avoiding social events or long drives because of fear of the nearest bathroom. I've seen men reclaim aspects of their lives with small daily changes, and I've also stood beside those who ultimately needed medication adjustments or procedures. The goal here is to give you options and agency. Start with one habit tonight, the easiest for you to stick with, and add another tomorrow. Before we go on to questions and practical troubleshooting, hear this safety note. If you experience pain with urination, visible blood in the urine, sudden and severe inability to pass urine, fever with urinary symptoms, or any other acute change, seek medical attention promptly. Those are red flags that require urgent evaluation. Also, if you are on blood thinners, have significant heart disease, or are taking prescription medications for prostate symptoms, talk to your clinician before making major changes. These habits are adjuncts to proper medical care, not substitutes for it. If one simple choice could make your nights easier and your days more confident, which habit will you start tonight? Take the small challenge. Tonight, either go for a 10-minute walk after dinner, skip fluids in the last hour before bed, and try the 5-minute pause next time you feel urgent, or add a small portion of cooked tomato to your meal and reduce the plate size slightly. Pick one, do it tonight, and write down how you feel in a week. If this brief plan felt helpful, please subscribe, like, and comment below which habit surprised you most. Your comment might help another man take that first step. Share this with someone you care about so more men can regain a little control over symptoms that don't have to define their days. Questions and practical troubleshooting. Let's move into the common questions men bring to clinic and the practical fixes that often help when habits alone don't solve the whole problem. Read these as a toolbox. Pick the tool that fits your most bothersome symptom, try it consistently for a few weeks, and track results. If I still wake up every night, what next? Keep a bladder diary for 1 to 2 weeks. Record fluid volumes, timing, caffeine, alcohol, number of voids, and nocturnal awakenings. That data helps you and your clinician see patterns. Reinforce evening rules. Avoid alcohol and caffeine after mid-afternoon if you're sensitive. Finish most of your daily fluids at least 2 hours before bed. Use the 5-minute pause when urgency begins so the bladder can settle. Consider timed voiding. Go to the toilet at set intervals, for example every 3 to 4 hours, and gradually lengthen the interval by 15 to 30 minutes if comfortable. This retrains bladder sensation and reduces panic-driven rushing. If nocturia persists despite these steps, discuss with your doctor. Causes include large overnight urine production, nocturnal polyuria, poorly controlled diabetes, sleep apnea, or medications. A simple measurement of nighttime urine output, review of medications, and possibly screening for sleep apnea can reveal contributors. My stream is weak. Does that always mean surgery? Not always. Weak flow often reflects obstruction from prostate enlargement, but it can also be due to bladder muscle weakness. First-line steps: pelvic floor and bladder training, double voiding, urinate, wait a minute, then try again, and avoiding straining when voiding. If symptoms limit life or tests show significant residual urine volume or obstruction, medications, alpha blockers for quick relief, 5-alpha reductase inhibitors over months for shrinking the gland are commonly tried. Combination therapy is effective for many men. Minimally invasive procedures, prostatic urethral lift, steam therapy, and transurethral resection, TURP, are options when conservative measures and medications fail. The choice depends on prostate size, anatomy, and your priorities about recovery and sexual side effects. Discuss these trade-offs with a urologist. What if I feel sudden, intense urges that I can't control? Use urge suppression. When the urge hits, stop and sit down, breathe slowly for 60 to 90 seconds, tighten your pelvic floor muscles briefly, and distract your attention. Count backward, recite a poem. These techniques often abort the urgency wave. Bladder training and scheduled voiding reduce frequency of urges over weeks. If urgency and leakage persist, there are medications for overactive bladder, antimuscarinics, and a beta-3 agonist that may help. However, they can cause side effects and must be chosen carefully if you have significant urinary retention or certain heart conditions. Are pelvic floor exercises useful for men? Yes, strengthening and learning to relax pelvic floor muscles helps both urgency and incomplete emptying. A physiotherapist experienced in male pelvic health can teach correct technique. Many men initially contract the wrong muscles and need guided training. Try short contractions, 5 to 10 seconds, followed by full relaxation, 8 to 12 times per set, 3 times a day. Quick flick contractions can help suppress urgency. Consistency matters. Expect weeks to months to see measurable improvement. Should I worry about PSA and prostate cancer? PSA screening is individualized. PSA levels can be influenced by prostate size, inflammation, and recent procedures or manipulations. If you haven't had a PSA checked recently, discuss risks and benefits with your clinician, considering age, family history, and overall health. If you're taking 5-alpha reductase inhibitors, remember they lower PSA by about half. Clinicians must account for that when interpreting results. An elevated PSA doesn't automatically mean cancer. It's a signal for further evaluation, repeating PSA, imaging, or referral to a urologist. Don't ignore significant changes, especially a rising trend. What about medications? What works and what side effects should I expect? Alpha blockers, tamsulosin, alfuzosin, etc., often improve flow and urgency relatively quickly, days to weeks. Side effects? Dizziness or lightheadedness, especially when standing, and sometimes ejaculatory changes. Take care when starting or combining with other blood pressure-lowering drugs. 5-alpha reductase inhibitors, finasteride, dutasteride, reduce prostate size over months and can lower the need for surgery long-term. Side effects? Decreased libido, erectile difficulties, and less commonly breast tenderness. They also reduce PSA and take 3 to 6 months to show benefit. Combination therapy can be more effective for larger prostates. Tadalafil, daily, has evidence of improving both erectile function and urinary symptoms for some men. Overactive bladder drugs, antimuscarinics and mirabegron, help urgency and frequency, but must be used cautiously if there is significant retention risk. Always review all prescription and over-the-counter drugs with your clinician. Antihistamines, decongestants, some antidepressants, and anticholinergic agents can worsen urinary symptoms. Are supplements helpful? Many men try saw palmetto, beta-sitosterol, or other herbal products. Evidence is mixed. Some men report modest benefit, others none. Supplements can interact with medications and aren't tightly regulated. Tell your clinician what you're taking and treat supplements as adjuncts, not replacements for medical care. How do I handle travel, long meetings, or social events without constant anxiety? Plan restroom access ahead of time when possible. Limit fluids in the 2 hours before travel or meetings. Take small sips rather than large gulps. Use the 5-minute pause at the first sensation of urgency. Wear clothing that allows quick access to a restroom. Consider a travel plan with regular comfort stops. For long flights, schedule a walk every 60 to 90 minutes if feasible to aid circulation and reduce bladder congestion. What if I suddenly can't pass urine? That's an emergency. Seek urgent medical care. Acute urinary retention may require a temporary catheter to relieve the bladder and prompt evaluation to find the cause. Don't wait. This can be painful and can damage the bladder or kidneys if delayed. How long should I try lifestyle measures before expecting to change course? You will often notice small wins in days to a few weeks, less anxiety, fewer leaks with pelvic training, improved sleep after fluid timing. Meaningful symptom changes from diet, weight loss, and consistent walking typically appear within 4 to 12 weeks. If there's little to no improvement after this window, or if symptoms worsen, re-evaluate with your clinician to consider medication, further testing, or referral. Which tests might my doctor order? Urinalysis, to rule out infection or blood. Post-void residual volume, ultrasound to see how much urine remains after voiding. PSA, if indicated by age/risk factors. Urine culture if infection is suspected. Uroflowmetry, a flow test, or referral for cystoscopy or imaging if there's concern for anatomical blockage. Sometimes a trial of medication is begun empirically while testing continues. When should I consider procedures or surgery? Consider procedural options if you have recurrent urinary retention, recurrent infections, bladder stones, recurrent gross hematuria, significantly reduced quality of life despite medical therapy, or if tests show high residual volumes or bladder damage. Less invasive office procedures, prostatic urethral lift, steam ablation, can work for selected men and usually have quicker recovery and less impact on sexual function. Transurethral resection, TURP, or enucleation procedures, HOLEP, are more definitive for large prostates or severe obstruction. They provide durable relief but have longer recovery and different side effect profiles. Discuss goals and priorities with your urologist. Small habits that pay off. Treat constipation promptly. Straining increases abdominal pressure and makes urinary symptoms worse. Manage weight. Abdominal fat increases pressure on the bladder and pelvic floor. Reduce caffeine and alcohol if they worsen urgency. Keep a supply of loose, comfortable clothing and consider absorbent guards if leaks cause embarrassment while you're establishing other strategies. Tracking progress and when to follow up. Keep a bladder diary and symptom score. There are short, validated questionnaires your clinician can give you. These objective measures make it easier to see trends and to decide whether to escalate treatment. If you start a new medication, plan a check-in in 2 to 6 weeks to assess side effects and benefit. For surgical plans, ask about expected recovery time, success rates, and sexual or urinary side effects so you can weigh trade-offs. Final note of encouragement. Small, consistent changes often yield the biggest improvements. You don't have to do everything at once. Pick one habit tonight, pair it with one practical technique from this list, and measure your progress in weeks. If symptoms persist or you're unsure about tests or medications, your clinician or a urologist specialist can guide the next steps. The combination of behavior change, selective medication, and targeted procedures means most men can find meaningful relief and regain confidence in daily life. If you have a specific symptom or scenario you'd like practical steps for, tell me which one, and I'll give a focused plan you can start tonight.